Okay guys, today I'm going to be speaking specifically about proper hand placement when you're inserting an IV behind the forearm. What I love most about this location is that nobody ever goes there. So the skin is typically smooth and you rarely see any scar tissue. I like to tap the vein while the arm is completely extended. I do this because it helps with blood flow. Once you have the patient bend their elbow, you can sometimes have difficulty getting the vein to plump up if you don't start by first promoting the blood flow when the arm is completely straight. I recommend to find a position that works best for you. I like to have the patient's elbow rest behind the bed's mattress, a pillow, a table, or really anything that can keep it stable. And as always, make sure to give frequent breaks with the tourniquet. Many of you ask why I tap and flick the vein, and it really comes down to the reason of adding extra blood flow to the area. On camera, it may appear painful, but I assure you it's not. I like to use more of a motion in my wrist instead of my arm, and I do this because less weight is used when you flick or tap the vein with your wrist instead of using the weight of your arm. If your patient's lying in bed, I suggest standing near their head on the side that you plan to insert the IV in. I also recommend lowering their head of the bed to about 45 degrees or more if they're able to tolerate it. And if at all possible, the best position for the back of their forearm is if their forearm is basically at a 180-degree angle. Hand positioning is everything, and this maneuver relies so much on your non-dominant hand to really grip and hold the vein in place. Always be sure that you're pointing the needle in the direction of the vein so that you don't accidentally puncture another hole. You want to release the tourniquet as soon as possible. In this video, I'm using the BD InStyle AutoGuard blood control catheter, so I do not need to keep pressure above the insertion site. This location is ideal for patients with confusion or history of Alzheimer's disease because the location keeps the IV out of sight, making it much less likely to be fiddled around with. Keeping it out of sight and out of mind is important to consider in patients that you worry about them self-removing the IV. I hope you all enjoyed this video, and please don't forget to subscribe to get the first look at every video that I post.